Hi, my name is Brad Skeels, and I've been dealing with an enlarged prostate for more than 20 years. I've been in the transportation industry for most of my adult life, and in 2009, my wife and I decided to move to Georgia to try something different. We were there for a couple of years, and after the grandkids started coming in 2011, we decided to move back home to California. We learned that during that trip, it was more difficult time going to the restroom more frequently, and it just seems to be escalating more and more and more all the time. Up till now in 2017, it became really more problematic. I had kidney stones, and after that procedure, my wife and I decided that there's just something had to be done. All the other procedures that we had looked at were a lot too invasive and a lot of side effects and a lot of problems along with them. So we decided to see what else was out there. At that time, I looked over the internet and I met Dr. Walker on the internet.
BPH stands for benign prostatic hyperplasia. It's a condition that causes the prostate to get larger as a man gets older. The typical symptoms include a decreased urine stream, getting up at night several times to empty the bladder, a sensation of not being able to empty the bladder completely, as well as hesitancy or straining to try to get the bladder empty.
We went into Dr. Walker's office after finding him on the internet with a little bit of skepticism in the beginning, of course, because he's brand new. And the minute I met Dr. Walker and his staff, I felt completely comfortable. I felt relaxed. I was able to speak about things freely. I didn't feel inhibited at all. And I explained to him from the beginning how things had progressed over the years and how it got worse and worse and worse. And we wanted to see what our options were to do something different.
Typically, if a man goes to his doctor with complaints of urinary difficulties with an enlarged prostate, he'll be started on one of two medications, one that either relaxes the muscle tone of the prostate muscle tissue or one that shrinks the gland down in size. And both of those medications can have some definite benefit, but they have limitations in how much they can do, and they can typically cause some side effects related to sexual function and even affect blood pressure or nasal congestion.
It's been quite the experience for me. 20 years of prostate issues, watching my husband have infections and wake up 20 times a night, the urgency, the pain, stopping on the side of the freeway because he can't wait till we can find a place. Just whatever my husband has gone through, it's been really a difficult journey for the both of us for many, many years. Recently, this year, he got a kidney stone, and there was way too many complications with regards to that because of his prostate. So we were very open to Dr. Walker's suggestion of this new procedure, this Urolift procedure, as a hope to make life better for Brad.
Most men who have tried medication and determined that it's either not working or they have undesirable side effects will be offered a surgical procedure, which usually involves cutting of tissue or thermal heating of tissue, and they'll typically have some concerns about side effects. There may be some prolonged recovery from those more invasive procedures. So when the Urolift came about, it was found to be a procedure that didn't require any cutting or removal of tissue and could be performed in a minimally invasive setting with no real side effects, and quick improvement in symptoms and quick return to normal activity.
Dr. Walker introduced me to the Urolift procedure. He had mentioned that it was a fairly new procedure in Europe that came over to the United States about 5 or 6 years ago and had very little, if any, side effects whatsoever. It was non-invasive, and it was something that could be done locally in the office without putting you to sleep or any really inconvenience to you whatsoever. That sounded really intriguing to me, and so I asked if there was something more literature I could learn about it and become more comfortable with it, and does he do it in his office, and so on and so forth, and he said that he did.
Well, when I evaluated Mr. Skeels, he'd already been on medication therapy for several years and obviously was not getting very good results with that. We had discussed some other treatments that were a little more invasive, such as the laser TURP and the TURP procedure. He was hesitant to undergo something more aggressive, and I thought he would be a great candidate for the Urolift procedure. When we discussed it, we went through the brochure. I showed him a video of how the procedure was performed, and the nice thing about the procedure is that it could be done in the office, and it could be done as a same-day procedure where he would be able to go home and resume normal activities almost immediately. The other benefit is that he would be able to leave the office without a catheter, and that was a big plus for him. He had had a catheter in previously after he'd gone into urinary retention and really didn't want to have the catheter again. So this was definitely a bonus in regards to the Urolift procedure.
When my wife and I got to the doctor's office that morning for the procedure, I was, of course, a little bit nervous and not quite sure what was going to happen. And we got met by the doctor and his staff and were taken back to the room where the procedure was done. Very, very comfortable, very welcoming. He made me comfortable on the little doctor's bed there that they have. He allowed my wife to come in with me and sit next to me during the whole procedure. And when he got started, I didn't feel any discomfort whatsoever. There was a little bit of pressure, and that was about it. It seemed like it was just a very slow, methodical procedure, and I never felt pain. I never felt uncomfortable. I never said, "Hey, you need to stop," or it was just very smooth, very easy, very simple.
Dr. Walker was very kind and compassionate with our million questions that we had to ask. We were very, very nervous about the procedure. But in the end, on the day of the procedure, it was pretty amazing. We went in and they helped my husband get comfortable, did a little bit of ultrasound, got us set up for the procedure. He allowed me to be in the room with Brad, so that was really nice. And then we walked out of there, literally walked out of there, which was kind of amazing for both of us. We didn't really expect that. And it's been a really blessed situation ever since then, because my husband can sleep now and we can do our activities, our tennis and our walking and our golfing and the things that we enjoy without always having to look over our shoulder for the nearest bathroom, and haven't had any doctor's appointments for urinary tract infections. It's been really amazing. We're really thankful for the Urolift procedure and how it has changed our quality of life.
So after the procedure was over, I just took my wife by the hand and walked out of the doctor's office, thanked them for everything, and went home and started back about our normal activities. The very first night I slept most of the night, got up one time to go to the restroom. The next day I decided to go play some golf, so I went out to the driving range and hit a few balls, and I actually started to play the game, and I didn't have the urge to go to the bathroom at all. Around the 9th hole, I thought maybe I better go in and try to go just to make sure, but I didn't really feel an urge at that point. I did go to the bathroom. I kept getting amazed because it was so easy. I got home, I was telling my wife how excited I was that I had made it through the whole round without all the interruptions, and she said, "Great, would you feel like going for a walk?" And I said, "Sure, let's go." So she and I went out, took a long walk through the neighborhood. There's a small park there. We went out to the park and walked around the park and sat on the bench a little bit and just talked about stuff and how grateful we were and how we wish we had started that procedure more than 15 years ago. It would have been great. Our life would have been different for a long period of time. Dr. Walker made it so easy. He was so competent that I just wish I had met him in the beginning rather than somebody else.
Over the years, we've talked about many procedures, things that we can do to try to help, and all of them had side effects and scary things that we did not want to negotiate. So when the Urolift procedure became available, it seemed like the right option for us, and we're wishing we did it much, much earlier, because it really has changed our life.